For today's lesson, we're going to take a look at fear. And in particular, we're going to take a look at some of the anatomy and function that allows us to experience this particular emotion. The main structure that we're going to focus on is the amygdala, or what is also known as the amygdaloid complex. Sometimes when we talk about the amygdala, it makes it sound like it's just one structure, but in fact it's made up of at least 12 different regions. For this course, we're going to focus on three major regions: the lateral nucleus, LA for short, basal nucleus, B, or the central nucleus, CE for short. The lateral nucleus receives input from the ventromedial prefrontal cortex, which you'll remember is important for decision making, and it's going to analyze risk and fear in that decision making, which makes sense because we're talking about emotional issues and the emotional role that the prefrontal cortex will play. And it's also going to be important in inhibiting emotional responses, as we'll see a little bit later. It's also going to receive input from the thalamus, which is your sensory relay station, as well as the hippocampal formation, which is going to be important for learning and memory, which makes sense. If something is a fearful stimulus, we probably want to learn something about it and remember it for later. The lateral nucleus sends its major outputs to the basal nucleus of the amygdala, as well as the ventral striatum. This is going to be important in the reinforcing components that we see in learning, as well as the dorsal medial thalamus, which is going to then project to the prefrontal cortex. So what we're going to see is that there's a lot of circular connections. There's going to be information coming from the prefrontal cortex into the lateral nucleus of the amygdala, and then going back to the prefrontal cortex to help with that decision making. Both the lateral nucleus and the basal nucleus send information to the central nucleus of the amygdala. The central nucleus is important for the expression of emotional responses that are elicited or caused by unpleasant stimuli. The central nucleus, or the CE for short, sends its input to the hypothalamus, midbrain, pons, and the medulla. If you have damage to the central nucleus, or the CE, what we're going to see is a reduction or a complete loss of the expression of fear, as well as increased tameness, and a decreased stress response, as well as lower stress hormones. So we're going to see the physiological changes that we associate with someone who just isn't going to get too upset by what used to be a fear or stress-inducing stimulus. So the stress response is going to go down, the corresponding hormones are going to go down, and the behavioral or physical response is going to be abolished. One particular syndrome that we see that is associated with damage to the amygdala is Kluver-Bucy syndrome. And this occurs when there's bilateral damage to the amygdala, and usually part of the temporal cortex as well. So when you look at the list of symptoms, many of those are associated with damage to the amygdala, but may also be a byproduct of some of the damage to the temporal lobe cortex. The symptoms of Kluver-Bucy syndrome are extreme tameness and loss of fear, or placidity, emotional blunting or flat affect, meaning that they are not having very strong emotional responses, if any. Also, kind of interesting, they have hyperorality, or what is sometimes called hyperphagia, which is a tendency to put everything in the mouth, including objects that typically humans or animals would avoid, like dangerous things like glass, or kind of gross things like feces. Sometimes we see hypersexuality or inappropriate sexual behavior, so they tend to engage in a lot of sexual activity and don't demonstrate some of the fear or concerns about the social taboos that would be associated with, say, public masturbation, or approaching somebody and trying to have sex with them, or trying to have sex with even an inanimate object. And some patients with this disorder have visual agnosia, the inability to recognize certain objects. So again, what we see, given that what we saw with the damage to the central nucleus, that we see this reduction in fear and this extreme tameness, we're going to see with further damage to the amygdala more problems or differences in emotional expression. Going back to the central nucleus, what we see is that some stimuli automatically activate the central nucleus, like loud noises, which are going to elicit a startle response that's going to be innate to humans and animals. The approach of a large animal will often trigger a fear response, as well as heights. For some stimuli, again, it's automatic. But for most stimuli, we have to learn to associate that stimulus with the corresponding danger or unpleasantness that it predicts. And this leads us to take a look at the conditioned emotional response, or a learned emotional response. This is a form of classical conditioning, which you may have learned about in intro psych associated with Pavlov and his slobbering dogs. What we're going to see here is that we're going to pair an initially neutral stimulus, such as a light, or as your textbook notes, a tone, with an aversive emotion-producing stimulus. In this case, we're going to use a shock. The shock is your unconditioned stimulus, or your US, or sometimes your UCS for short. It produces an unconditioned response, or a UCR for short. This is an unlearned response. So if I shock you, you're going to have kind of a jumping response or a flinching response. And if we're doing this with rats, they jump when they're shocked. And not surprisingly, their heart rate increases, their blood pressure increases, and their respiration increases. They don't have to learn anything about this. This is just what happens. If we take that unconditioned stimulus and pair it with the original neutral stimulus of the light, which we'll now call a conditioned stimulus. We'll pair that 10, 20, 30 times. So after several pairings where the light, now a conditioned stimulus, or a CS, proceeds and ultimately predicts the shock, which is our US, we're going to see that unconditioned response, in this case jumping. And because the shock is still there, the jumping is occurring to the shock. If after these 20 or 30 pairings, the animal learns the association, so that when the light comes on, the animal will respond to the light in a similar way as to the aversive stimulus, even if that shock never comes. In this case, what we see is that the rat exhibits something known as freezing to the light. In anticipation of the associated shock, they're freezing, thinking, oh, here's this bad thing about ready to occur. We will still have increased heart rate, blood pressure, and respiration. So the conditioned response, which this is now called, is sometimes a little bit different, but is essentially very similar to the unconditioned response. But because it is occurring to the light, the conditioned stimulus, we now call it a conditioned response. And when you see the word conditioned, you want to think of learned. It's a learned response. He's had to learn to freeze to the light, where he didn't have to learn to jump to the shock. It turns out that there are physical changes in the brain that occur when classical conditioning of a fear response or an emotional response occurs. And this happens in that nucleus, that lateral nucleus of the amygdala. Sometimes we don't want our animal to remain classically conditioned to that light stimulus, and so we can go through extinction to reduce the conditioned emotional response. The way that we would do this is that we would present the CS, in this case the light, repeatedly, but no longer follow it with the unconditioned stimulus, so that the CS, in this case the light, would lose its predictive value. It's no longer predicting the shock. We see light, 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 nothing happens, and so the animal's behavioral response will decline. It will freeze less and less. It's important to note that while that behavioral change may look like forgetting, that what's going on in terms of the brain is not forgetting. The animal does in fact remember. And we see this because what we see is that we get some inhibition from the ventral medial prefrontal cortex. So that when this light comes on, instead of saying, oh my gosh, I'm scared of the shock, the ventral medial prefrontal cortex inhibits that response. So in fact, what we have are two pathways. We have a pathway of the fear response and a pathway that inhibits the fear response. And this allows us to learn about stimuli and modulate our emotional responses to fearful stimuli.